We all know the importance of avoiding unnecessary antibiotic use, but if we're saving them for later, then who exactly are we saving them for? A new study published in the Lancet Respiratory Medicine sheds light on which patients, and in this case children, consulting their GP with a chest infection are most likely to worsen and be admitted to hospital, and so should be prescribed antibiotics. Equally, doctors and parents can be confident about which children with chest infection can safely be looked after at home. In the study, which included over 8,000 children, about a third had an antibiotic on the day they consulted, and about 1% were subsequently admitted to hospital. Using a 7-point checklist, the authors of the research were able to predict the risk of admission to hospital with quite remarkable accuracy. And they used the mnemonic of star wave to describe these 7 points. In an associated commentary in the same journal, David Price, Alison Chisholm and I argue that by moving beyond the blame game, the research could even help support shared decision-making in a challenging area of medicine. Being invited to write a commentary in the Lancet Respiratory Medicine is a great honour and reflects the work that David, I and colleagues have done in this area since 2001. At the time, there was a great focus on reducing antibiotic prescribing, and we were concerned that no one was interested in potential unintended consequences. In fact, we were the first people to show that a reduction in antibiotic use in the UK was associated with increased excess winter pneumonia mortality. And we subsequently undertook an analysis of patient-level data in the UK showing that antibiotics do reduce the risk of admissions and mortality from pneumonia in patients consulting a primary care physician with lower respiratory tract infection. This is work that I did initially as an honorary research fellow in David's group at the University of Aberdeen. This is a great example of what life is like at Oxford Pharmagenesis, that we build long-term and deep understanding of particular therapy areas we work in, and we really get to know the experts in the field, and we're respected for our opinions. And this is great validation for our health science approach to medical and scientific communications.